About 20 years ago, I was the executive director of the Regent Park Community Health Center, situated in one of the most economically disadvantaged communities in Toronto. We were investing in programs throughout the 90s. Our budget went from about $2 million to $6 million, but the conditions in the community deteriorated rather than improved. There were more gangs, there was drug selling, and murder started happening. So the more money we were spending, including a very large early years program, wasn't making a difference in this community. So that was the context in which we had this facilitated strategic planning retreat. We had board members there, we had staff members from the health center, and we had community members from the community. About 60 to 80 people were there. It was facilitated by ICA, and that is what sparked or catalyzed our vision of community succession. Okay, so what does that mean? Well, community succession meant that the young people growing up in that community would be the future doctors, nurses, social worker, executive director, et cetera, of the health center. We had no idea how to make that happen. So we then took the vision to the community. So we did focus groups, facilitated focus groups with all the different cultural groups in the community. We had translators. The feedback that we got from that, the information we learned, was that the community embraced the vision, and they told us, you got to focus on education and employment if you want that to happen. So now we knew the direction, but we didn't know specifically what or why. So we dug deeper, and we did more facilitated focus groups now with young people, with parents, with teachers, with agency representatives, with dropouts, and with kids who had so-called, achieved success, even though they grew up in that community. And that is when we learned what the obstacles were. And the obstacles for low-income students to graduate from high school and go into post-secondary are that they lack academic support, they lack social support, social capital, they don't have the money, so poverty, even for the mother to buy a bus ticket for them to get to school. There was no school you could walk to in Regent Park. And a scholarship, mentoring. So those are the interventions that we put in place for every high school student that wanted to participate, and we had about a 95% sign-up rate. And in 5 years, the dropout rate went from 56% to 13%, and post-secondary attendance went from 20% to over 80%. And that's what facilitation, a bottom-up process, resulted in the Regent Park community.